Okay, everybody, would you please take your seats? Thank you very much. And I truly apologize for not intervening at the end of that last session. Everybody was so engaged, and including our group in the back. And then I noticed people were turning around looking at me with some evil eyes, and I said, are we too loud? Shh. And then somebody looked at me and pointed to their watch, and I realized that we were going over time, and I'm really apologetic about that. Sorry. We will go into the lunch hour if we need to, because this is such an important session. And I'd imagine that we'll continue this dialogue after lunch in the consensus building process. We've been working on what to do this afternoon. We think we have some basis for strategies, and really looking forward to that. But without further ado, and some great anticipation for me, and I'm sure many of you, because I believe this is probably one of the most critical elements within the whole range of things that we've been talking about, music education, because this is where we can influence the training of and the preparation of teachers who would be the first frontline defense in the prevention of any health risks or awareness issues that a student, even as young as preschool, may be exposed to associated with music. And how this group projects a concern for those is critical. So without further ado, David Circle, President of MENC.
Thank you. We've heard some stimulating and informative reports from many of the distinguished panels, as well as some additional presentations on standards development, case law, and campus health services. However, this is the age of accountability in education. So now it's assessment time, okay? So would you please pick up your clickerless clicker? Bob, have you got that one ready? Can I see it from here? Okay, there's your question. Whoop, that's not the question. Let's try another question. This one is the one on vocabulary. All right. There we go. There we go. Yeah, there are a few snickers. Thank you. This was, I'm sorry, I apologize, a feeble attempt at a little humor. But as a result of all of these medical terms and so on, my mind was just kind of swimming. So I thought, well, you know, how many new words have we learned during these presentations? So, yeah, okay. Well, there will be some books in the offing, so that's good. Thank you, Bob. Our group has been having some stimulating, stress-free discussions during lunch these last 2 days. And our leader, Don Hodges, has done an excellent job of keeping the group on task and focused. And Don, thank you very much. We'd like to thank you for all of your work for us, okay? And a couple other thank yous while I'm in the thank you mode, because I'm a firm believer in showing appreciation. But Chris, you've been thanked before, and I'm sure you'll be thanked again. But the Music Education Group would like to thank you for your idea and your initiative of getting this whole thing started. So thank you, Chris. And if, as someone earlier said, if you've run one of these conferences or run meetings, you know how important the technology part of it is, and the video part and the sound part. But Bob, pat yourself on the back. We thank you and appreciate all of the work that you've been doing as well. So thank you. Because we're the last group to report, I would guess, Chris, that you had this in mind when you envisioned this conference. So it's like the quote, "All roads lead to Rome. All efforts and deliberations lead us to music education," and this is what our panel is about. We came to the realization yesterday that there are 2 levels of application for this conference. One, obviously, is at the university level, is publicized, as indicated by the title of the conference. But there's also a second level, and that's where we can have a widespread and probably more immediate effect on a larger population of music teachers and music students, and that is the K-12 level. Our group collectively believe that we should be working together toward, and this may end up being a quote, a culture of musical health at both levels. Each of the 4 subcommittees that you're going to hear will make succinct presentations, about 20 minutes, unless we run over. And then there'll be a brief question and answer period after that. So the first of these groups is vocal health. Elaine Bernsdorf from Wichita State University is the coordinator for this committee, and they will begin.
First of all, I'd like to thank all of the people that helped on this committee. We primarily had a virtual committee on the front end. Several of our members were not able to be here, but I really want to thank them, since this is being videotaped, for the information that they sent us. You don't have it in your notebooks, but we actually collected quite a bit of information on the front end, and I hope that we'll have an opportunity to get that into print and get it on the website, because it was a really collective effort, and I really appreciate everyone who helped with the presentation. We really are talking about the same group that David just talked about, and the fact that we're really talking about different levels of preparing helpful voices. Our undergraduate majors, and I think it's really important that we remember that we're talking about vocal and instrumental music educators. But also, a lot of us teach courses for elementary teachers, whatever the music methods courses are. And I'd like to throw that group in, because they are also a great source of information. And as a speech pathologist, I know they are also people who suffer from voice disorders. Also, when we think about K-12 or pre-K-12 information, when we're thinking about practicing music educators, suddenly the roles change. In college, they're vocal and instrumental music educators, but when they actually go out into the schools, we tend to give them the labels of general music teacher, choral teacher, band teacher, orchestra teacher. And so their environments sometimes are very different, the expectations are different, and I think we always have to keep that in mind. We can create a nice body of information that's sort of global, but unless we're meeting the specific needs of these different stakeholders, they won't embrace the information. And then finally, the children who are actually in the schools in our classes. So we kind of come up with 3 priorities that we think are important. One is to serve the teachers in the field. We've already had literature in our publications. We've had in-services at MENC conferences for years, but we need to continue and expand those offerings. We also need to, I think, really embrace the idea of referral services. I think that's one of the topics that's been most helpful to me at this conference, is just thinking more about the referral process and how we work together in a multidisciplinary manner. Also, giving regular access. We tend to have had special issues or special articles or a special session, but it may be that we need to continue to have a thread. Just as we have general music, choral, band, and orchestra, we may need to think of health in music as a thread that we have on a regular basis. Another interesting thing that we realized is that we really need some good low-cost media materials. I'm, as a speech pathologist, familiar with the Stuttering Foundation, and I get literature every month from the Stuttering Foundation about some videotape or some pamphlet or some booklet that they have for parents, pre-service and in-service teachers, and they're usually $10 or $15 for those materials. So coming up with good ways to have low-cost materials. We can't do anything until we increase the awareness of risk factors, and we've talked about that at length. I won't go into it. Also, the multidisciplinary research. Obviously, you've seen examples of that at this conference, but that's really a key for all of us. And I think partnering with school administrators, it's a lot of the solutions that we have out there may not be terribly expensive. They can be simple, and simple adjustments can sometimes make some big differences. But one of the things that for teachers who are out in the public schools is we want to retain them in the profession. I created one of the little questions, and we probably won't have time for it, but just a show of hands, how many of you know someone who has left the profession of teaching because of a voice disorder? And quite a few. Or they may continue to teach, but they suffer through it. And just breaking that cycle of risk. Our second priority is preparing new teachers, and those of you who are familiar with NCATE and accreditation purposes some things will jump out at you. In putting this slide together, their thought was that we really need a knowledge base, and we've got pieces of the knowledge base, but we don't necessarily have it infused in a complete package that makes sense to everyone, like we do for oral skills or theory or some of the things that we tend to teach on a regular basis. Also, ways, whoops, I'm sorry. Gotta go back. How do I go back?
The right button.
Thank you. There. Also getting really kind of protocols for how we monitor student skills. It's been really good to hear about that, but there are some simple ways that we can do it by just collecting some auditory data, perceptual data that we as teachers have. We don't always have to use instrumentation. Encouraging a healthy disposition. I think that we obviously, as was seen in the slide by how many people exercise and some of the things that we're interested in, we have a disposition for this, but not all of our colleagues do. And we need to continue to model that. And then, again, researching those risk factors, beginning to make that material more available. I actually like the term best practice, and I think sometimes we talk about recommendations and guidelines and standards. Those tend to have a little bit of a legislative sort of tone to them, and sometimes just thinking in the terms of best practices can be a way for our colleagues to embrace ideas and not feel threatened. And then finally, we, I think, as a profession, need to encourage and become comfortable with advising and presenting referrals for the services on our campuses and in the public schools. There are a lot of services within the school system that I think we don't utilize either. I really won't go over these, but these are just a couple of, a little set of practical strategies that we were talking about in our group. And one was just teaching people how to use verbal and nonverbal cues to reduce stress, to set up routines so that there isn't as much vocal use going on, to get more familiar with the data, to get their own set of personal resource materials, to also look at classroom environments. And we've talked about that. Those sessions have been really good here. But a lot of it is people, a lot of folks in the field are afraid to request changes or to ask for assistance. They're afraid that they will be looked at as uncooperative as teachers. And so sometimes we need to give them techniques for how to ask for simple and cost-effective solutions, just like the example of putting the rubber erasers under the speakers, just small things like that. And then advocating for their own personal strategies. Finally, I think that our team has agreed that developing a support system of some kind is just critical. Our final priority, or it's really the whole package, is preparing children for the future. And Valerie's going to talk about this a little bit. We've created a kind of a top 10 for you. But keeping those vocal production tasks developmentally appropriate. There's new research out, and we need to be aware of it. Infusing the knowledge and modeling good vocal health, and developing speaking and singing skills. How many of you ever had a course or somebody really talk to you about the speaking voice in teaching and how to maintain that health? Good. Sometimes we find that folks really have not had that kind of training in terms of how to handle the speaking voice. And also the whole idea of cross-training. It was interesting to hear how many of us have done some kind of cross-training. So Valerie's going to talk to you just a minute.
Okay, my special area is dealing with very, very young voices. And as Elaine mentioned, there's new research out, or actually it's a variation on research that's been around for a long time, but because we have more imaging techniques available, a lot of this research has really indicated to us and shown conclusively that very young voices from birth up until the adult voices are very different from adult voices. And we need to have our teachers more aware of this. So what we kind of put together was a top 5 for what the pre-K, we have the elementary students first. They got out of order? I guess, no, I think I went. Okay, we'll do them first. I'm sorry. We have the top, the top 5 for pre-K elementary students and the top 5 for pre-K through elementary teachers. I'm going to, yeah, it's not there.
Right.
Huh. Those are students. There we go. Okay, great. Okay, so I'm going to run through these quite quickly, and if you have any additional questions or so, you can ask any of us after we're done with this presentation. But what we've identified as some of the top 5 needs of our pre-K through elementary teachers is that they do need to know the development of vocal anatomy and the implications for curriculum. This is going to have to be a big foundation for any type of general music teaching course. It's very important. These teachers also need to develop a meta and proprioceptive knowledge of their own voice. We can only instruct them and teach them so far by just telling them what to do. They also have to have enough personal vocal training themselves so they can identify even problems in their own voice and work with their own voices. They have to know their own voice very well before they can start working with children's voices. They need to demonstrate the ability to model appropriately for speech, singing, and vocal health. They need to be able to recognize problematic vocal behaviors early in themselves and in their students. And from here, we, of course, take it to a referral system. I have told teachers I've known and worked with, when they hear a child who they suspect has something going on, first thing I've said is, well, get your speech specialist for your school district in and have them sit in and listen to the child sing and use his or her voice, because that person is trained and can give you a good idea right off the bat if there is something there that needs to be looked into. And lastly, they need to engage children in appropriate vocal activities and techniques for growth. Didn't go on. There we go. Now for the children, we have a set of goals and skills that we would like the children to have when they are young. They should, I started with first grade with mine, they should be able to identify simple anatomy and physiology. They should have a basic understanding of what is going on in their voices. And as they get older, learn more about how this voice is going to change through life. If you're not familiar with the journey of the larynx from birth through death, it is really fascinating, and with everything that grows in and changes. But these children do need to be familiar with what's going to happen through their lives. They need to be able to recognize healthy and unhealthy behaviors in themselves. They need to be able to know warning signs of their own unhealthy voice and how to seek help. If that having a sore throat is something they should realize is not normal, anything like that. They need to understand that, one of my favorites here, imitating adult or cartoon voices can be unhealthy. And I had a list of some of my favorites that I'd heard over the years. The Children from South Park was always fun. Beavis and Butthead, a lot of those. Fran Drescher, Gilbert Gottfried, and of course my favorite now with Lord of the Rings is Gollum. And they also need to know which kinds of vocal habits can be harmful. One thing I forgot to say, mention recognizing healthy and unhealthy behaviors. That also included issues such as smoking, and we do have problems with these in elementary school kids. Smoking, drug abuse with older ones, and even as young as 3rd and 4th grade, some of the girls will induce vomiting because they have that view of how their bodies are supposed to look. And we have cheerleading, I believe, on that list. Throat clearing. Can you think of any more that I'm forgetting? Anyway, that's all of that in a nutshell. So I'll give you back to Elaine.
Finally, we've decided that maybe the best way for us to do this is to develop a policy of best practice by the profession. Maybe not legislate or regulate, but come up with ideas for best practice. Support research in every way we can. Increase awareness among all of our constituents. Provide materials in accessible forms. Advocate health to and with other agencies and arts disciplines. We've talked about dance just a little bit, but I think if you think about all of us that are music educators can recognize the little book with the ribbons on it that has the national standards for art, music, theater, and dance. Thank you. Being able to think in a unit about health issues. Music is important, but I think until we really look at all the arts, we may not get as far down the road as we want to. and also supporting our members of the profession who have problems. We have a tendency to marginalize and be afraid of folks who have had problems with voice. And I think that we want to support them, but on the other hand, we sort of say, well, if they'd done it right, or if they really had, been more careful, or they must have bad classroom management. Sometimes we have a tendency to beat up on our own profession just a little bit, and we need to be careful of that. And finally, I think we've got this same thread of promoting a culture of vocal health for all music educators. Thank you. Oh, one more. Chris, thank you so much. Thank the organizers and also the sponsors, because without that sponsorship, I think a lot of us would not have been able to attend. We will take questions if you have questions, or we'll continue to move on. Yes, sure.
Okay, I think I'm on now. I just wanted to underline that some of you might wonder why we're talking about the elementary school so much in this regard. And the idea is that many problems, or the painful syndromes, as Alice talked about yesterday, are a result of the habits learned from pre-K through 12 grade experiences. So that what we're seeing in the college level, in the four-year college and beyond, many of those problems are learned from habits at the younger ages. So to make an impact, we need to go to the youngest ages of the children and help them with their habits they are acquiring when they are growing.
I might make one other comment. I do a lot of preschool work, and one of the things that we have to counteract is, 20 minutes of music 3 times a week is not going to counteract the classroom teacher who sings with her class down around the A below middle C. They've had how many years of preschool teachers who basically speech sing at very low levels, and it's no wonder that we have to start with pre-K to start modeling what's appropriate vocal use. So, any other questions? Thank you. Yes?
Harping on the emotional
Yes.
side of things, but I would think that maybe having a little bit of training in emotional intelligence for voice students, just so that they understand the effect of sadness on the voice, or anger, or anxiety and fear, things like that, and can learn how to modulate those kinds of emotions.
Yeah, and I think maybe we should add that impact. I think that teachers who are experiencing vocal stress and students that are experiencing vocal stress do not really realize that a lot of times, how many of us can produce the teacher voice like that? You can turn on the teacher voice, and if you think about the production, it's a crisper, more glottal attack. There's a tension there, and teachers, when they are dealing with classroom management in classrooms, will automatically shift to a different kind of vocal production in their speech, which tends to not be a healthy vocal production. And so I think that is an aspect of it, but also helping children understand that emotion and getting things out and feeling more comfortable about themselves through music can just be overall general health better. Thanks. Anything else? We will let the next group come up.
You will hear in our summary a little bit at the end of these presentations some general summations of recommendations and actions that we feel can be taken. Our next group is the Hearing Health Group. This was coordinated by Pat Sink from UNCG, and she will, as soon as Bob gets our stuff, see how important this is? There we go.
Wherever you think you should go. There you go. Thank you. It's truly a delight to be here, and I just want to second and third and whatever, all the comments about thanking Chris Chesky and all the organizations that have helped to support this. The hearing subcommittee consists of 3 committee members, and our names are listed there. Corinne DeVroop, Doug Owens, and myself. And we've worked together since probably about the middle of August to the end of August in preparing for this conference. And we've also had input from Chris Chesky and Don Hodges, and all of this has been very helpful. What we were excited about was when the presentation by the hearing work group occurred on Thursday, that our preparation and our recommendations very much aligned with their presentation and wonderful information that they gave to us. In fact, one of them is still with us, and we invited Jennifer Tuff to sit with us in case there were some specific questions. She came into our working lunch yesterday and said, well, what can I do? And I said, well, come and sit with us. So she indeed is. We have made several recommendations, which are numerous, they're broad, and they're expensive. And I say that because they will seem somewhat ideal. But we wanted to put these recommendations before you so that we would have the opportunity to discuss them as a group. Because the working group gave us many details that very much support or at least explain some of the recommendations, we're not going into detail because we would like to have the opportunity as the remaining group here to do some discussion of this, and so we invite you to do that, and we'll open the floor up after our presentation. We've divided the recommendations into 3 categories. The first category, education; the second, research; and the third, advocacy and lobbying. And if you'll look in your notebooks, if you can find it, in the Music Education Committee report, we began on page 4 of 19. So if you'll start there, I think we'll kind of all be on the same page somewhat, because I'm going to make some references to that report, and Corinne and Doug may also too. Okay. As far as education, we have 3 recommendations. And remember, we're saying these are ideal. And probably they're at a point right now to explore the feasibility of applying them. And the first one, I think, would be very important to pursue the development and implementation of a national hearing conservation campaign sponsored or in collaboration, not sponsored, but in collaboration, okay, in collaboration with MENC, or at least pursue the feasibility of doing that, so that we can begin to increase the awareness of our music teachers, K-12, university, college teachers, and students, parents, administrators, through the development of packets, in-service, etc. The second recommendation is to include hearing protection education, integrate that in the music and music teaching and learning curricula, K through university college levels. And obviously that would need to be age appropriate, but such a program would include information about hearing physiology, would include information about hearing protection and how to conserve one's ears. And then finally, an implementation of a hearing conservation program in our schools. And if you'll look on page 6 of 19 in the packet, you will see there 2 basic paragraphs. One indicating the OSHA regulations as far as a hearing conservation program, and then some possible suggestions as to what a list of these as to what a hearing conservation program may be. Now, folks, I know you look at those and go, that's going to take some money, and indeed it is, but I would hope that this will increase our awareness as far as what a hearing conservation program may involve over time. The next area is research. And definitely, we encourage the collaboration between music and audiology researchers. And Dr. Coakley, is he still here? He may not be. But I would say that audiologists very definitely welcome schools of music faculty collaborating with them. And I think back and when John Deal, the Dean of the School of Music at UNCG, came to UNCG and began to initiate that collaboration, and it's still going on today, and a lot of good research and service being provided by that. The audiologist, the music educator, music researcher brings to the table different areas of expertise. But to bridge the gap between research and practice, we must make sure that the application of the research results are realistic and practical. And requesting that our band directors tell their brass players just to put mutes in their instruments, that's not very practical and won't work to protect hearing. The second area is that sound level exposure research needs to be conducted at all levels of music education. Much of the sound level research has been done with orchestral musicians and rock musicians. And so we need it at all levels, involving choral, general, instrumental, performance studios, whatever. We need research in all the different areas on that. Finally, our professional organizations provide us a wonderful service as far as publication of journals, dissemination of information, and we would encourage that we get our information of results and writings in the area of hearing conservation into our professional organization journals, because that's essential. It's essential that this information be available to the broadest spectrum of individuals involved in music teaching and learning. Finally, our third area is advocacy and lobbying. Lobbying would be working with school administrators, working with government officials to try to get the word out. Hearing conservation is very important, and very important for music students and teachers. The first one, very simple, use of hearing protection. We encourage that, whether it be with earplugs or shields when you're performing in ensembles. The second area is to make sure to modify the music classrooms with cost-effective and appropriate sound absorption materials. Now, the two operative words here are cost-effective and appropriate. And how can that be done? Well, we're not sure yet, because it is very expensive to revamp rooms so that they provide an appropriate sound level that is not harmful to one's ears and hearing. And I think we were given by the working group some practical suggestions on that, but I think we'll need to continue pursuing what are cost-effective and appropriate means to do this. Also, we need to assure that our music classrooms are suitable for music teaching and learning. That means, do we have the correct absorptive materials? What is the sound level in the classroom? To give a teacher a dosimeter, well, we couldn't do that. They cost a lot. But to provide a music teacher with a sound pressure level meter, just to find out what the level is as far as their classrooms, if they are indeed concerned about the sound level occurring in their rooms. The next recommendation is to communicate with administrators about hearing protection as that relates to the size and number of music ensembles, lessons, and classes occurring within a teacher's schedule. Teachers need rest time when they've been exposed to somewhat intense but variable 95 dB in their concert band or their marching band. They need rest time and downtime. So that's another area in which we need to communicate. We recommend the use of the NIOSH criteria as far as measuring sound level. And I think we heard from the working group that indeed OSHA really is designed to regulate industries and not schools. And OSHA is a compromise somewhat between what NIOSH has indicated is excessive as far as sound level and also meeting political desires. And so NIOSH, since we're most concerned about hearing protection, preventing hearing loss, NIOSH is a much more conservative means to use to measure sound level exposures, and we would recommend that. And finally, increased accountabilities of schools for protecting music educators and students' hearing and to help to prevent hearing losses. Now, those are our recommendations. We want to go a little bit further after this, but I first want to ask Corinne if you could come up and talk a little bit about publications and dissemination of research.
I think during the course of this, the conference, hearing loss has received more than its fair attention. It's been in the spotlight and seems to have permeated most of the sections. Personally, I just believe it's hearing, as opposed to some of the other areas of concern, is central to education. It's an aspect that's going to permeate the development of our students from the very first contact with the profession till the point that they exit the profession or go on to be consumers, throughout the careers. In terms of research, Jeff Coakley outlined several recommendations that I think were very well articulated. Some of it may be a little above our heads as music educators, but like Patty recommends, collaboration between some of the audiology faculty and music faculty will facilitate, and the Center for Music and Medicine is a good example of that kind of collaboration. I would just strongly recommend that as educators, we need to know what's going on in our ensembles. I would advocate that we go out and get measurements of our ensembles at the university level and at the school level, and focus more on ensembles that are typically not covered. We tend to have ignored some of the ensembles like your marching drum lines, drum and bugle corps, and our ensembles that primarily have electronic instruments in them. We need, as educators, if we want to make change, if we want to make recommendations for improvement, we need to know what's going on. And at this point, it's important for us to go into our ensembles. And this is something that's doable by music education faculty. I know it's going on at North Carolina and several other universities around the country. That's just something I would advocate. Understanding what's going on at the school level is also important. Now, one of the reasons why I posed a question to Jeff was there's very strict protocols in terms of how one goes into a public school environment. Several of the school districts will not allow you to just come in and conduct experiments with their kids. There's a level of resistance, and justifiably so, because the goal of the administrators is to protect their students. Nevertheless, we need to find creative ways of going in, and Elaine caught me after the last presentation and said she's done some of it. Those are the kind of research agendas I would like to see us pursuing.
Ask Doug if he would to talk a little bit about room suitability, impact on hearing loss, and take it away, Doug.
Thank you. If I could just add to Corinne, that research piece is so vital to what we do. Much of the research that I have done in the schools, the public schools, again, was difficult to obtain. The band directors, the orchestra directors, the choir directors want to have their rooms measured. In some cases, the administrative structure just wouldn't support that, and there are many reasons for that. The teachers that are in our schools want this information. It's very clear to me that they want this information. If I could speak just from a personal standpoint for a second, as a former middle school and high school band director that has experienced noise-induced hearing loss, the perception, at least that I had, was that my loudest ensembles were my largest ensembles. And that's not always the case. So as Corinne says, you know, getting in there and measuring all of the sounds that exist in the room is quite important. To speak to the facilities point, again, as educators, we work to bring students into our programs and to expose our students to music in many ways. And as our programs grow, we have to be aware and to take on that responsibility of continual monitoring of what's happening in our facilities. You know, as we continue to build our programs and we put students in small facilities that perhaps were not appropriate to begin with, we are creating a problem for ourselves. I created that problem for myself. As I built my program from 100 students to 208 students, the scheduling issues changed slightly, but we only had so many places to put our students. And as a result, my exposure levels increased. Looking at the exposure time, of course, is large as well. I guess as a general recommendation for teachers, purchasing that inexpensive sound pressure meter, which is ultimately what I did when I ended up having literally painful experience with noise-induced hearing loss. $50 meter, monitoring the exposure, making charts, making recommendations to administrators, and really going out on a limb and saying, look, this is not healthy. It's not healthy for our students. It's not healthy for our teachers. It really is going to take that type of effort on the part of all of us, backed up by our research and your research, backed up by really experience of the educators that are out there. The other point that I want to make is that that emphasis of the NIOSH and ISO standard, knowing that it is the more stringent standard that exists, and using that as our own standard of looking at exposure. The knowledge is the key, and awareness of this problem is certainly one that will help us begin to avoid this particular problem in the schools. But the word has to get out one way or another, and these are large goals. But looking at the standpoint of music as a whole, the fact that we get into this for the music, we have a passion for the music. When you're faced with living without the music, it's a big deal, and it's something that's central to all of us. So,
Thanks.
Sure.
Any comments, questions, anything that we've overlooked you want to add? Okay, we'd love to talk more. I think we need to move on now. Thank you.
At the very end, we will have a little more extended, and if everybody doesn't go overtime, we'll have a little more extended question and answer time. So, next group is the Neuromusculoskeletal Health Group. Judy Pollack from Michigan State University is going to make this presentation on your own computer, or? Okay.
just waiting for my notes to boot. But while we're doing that, let's see. Okay, we've done enough sitting around at this conference now. So, and this is very pertinent to my presentation, to our presentation. So I'd like you all to stand up, if you don't mind. And I'd like you to put your right hand in and put your right hand out and put your right hand in and you shake it all about. You do the hokey pokey and you turn yourself around. That's what it's all about. Left hand, you put your left hand in, you put your left arm out, you put your left hand in and you shake it about. You do the hokey pokey and you turn yourself around. That's what it's all about. You do the hokey pokey. You do the hokey pokey. You do the hokey pokey. That's what it's all about. Thank you very much. You can sit down. Actually, I did that for myself because I'm a little nervous and that always calms me down. I'm the chair of the Neuromuscular Skeletal Health Subcommittee, and I'd really like to thank Chris, all the sponsors, all of you for being here, and my panel for the hard work they've done, especially right here and all the thinking that they put into this. So, and let me find my notes here. Our recommendations we grouped into 3 topic areas very similarly to the previous group: education, research, and advocacy. Our education, here we go. Our education topics we grouped under, where our education information we grouped under topics somewhat like the content standards for MENC. And we felt that, and by the way, this is not in your book because we've reformatted everything since we arrived. We felt that all pre-service and in-service music educators, so that would cover our School of Music students as well as teachers in the field, need these types of information. They need to know what kinds of neuromusculoskeletal injuries occur. And that information came from our panel yesterday. Such things as musculotendinous pain syndrome, nerve entrapments, and focal dystonias. So they need to know what types of things can happen. They need to know the risk factors for injury. And those were covered so well by the panel yesterday, such as increase in performance time, that word stress that we all love so much, life changes, and naturally occurring anatomical variations such as hypermobility. They need to know the basics of anatomy, physiology, and we think biomechanics, so that they know how that we move in space, how our limbs operate from a mechanical standpoint as well as a physiological standpoint. They need motor development information to know that a teenager moves differently than an adult that moves differently than a child. For example, children don't have the same kind of motion when they throw a ball that adults do. Their muscles don't release quite the same way that adults do. They need to know about the acoustics of particularly instrumental sound pertaining to neuromusculoskeletal health, how the acoustics of the instrument and the room affect their level of effort and their biomechanical production of sound. They need to have visual, and this is very important, this is taught very much in instrumental methods courses, but not always in a very healthy way. Visual and auditory diagnostic skills. In other words, when we listen to sound and we look at the way a child is playing, how do we correct them in a way that's healthy and body, mind, sound? The teachers need to know the effects of non-musical activities on kids' health, and this was talked about yesterday as well. One bass player one day came in to me and said, I'm really having trouble with my hand, Dr. Pelican. I'm worried that it's from my bass playing. And we went through the list of everything he'd done in the last week, and he realized that he had skidded on a floor playing some kind of game and put his hand out to stop himself, and that's where the pain came from. And it resolved naturally within a couple weeks. It wasn't a playing problem at all, although sometimes it can result in musical injuries. Teachers need to know the effects of various diseases and medications on their kids' musculoskeletal health, neuromusculoskeletal health, so that they know that some things may not be from playing, but can affect playing. They need to know strategies for neuromusculoskeletal injury prevention. This is actually a very big area, and unlike the strategies for hearing conservation, are often cheap, dirty, and quick. I mean, they're easy. Things like taking a break during a rehearsal, managing the workload in the concert. Some of them are just almost common sense, but we don't always use our common sense when we're teaching or making music. Let's see. General physical conditioning is another preventive strategy, and also warming up and cooling down, which I don't think has been mentioned so much, but that's what we just did, has the benefit of not only getting our blood flow going, but calming us down if we're nervous, breaking the ice. It's a good mental health strategy as well as a physical strategy. So it kills a lot of birds with one stone, as somebody said yesterday. We need to know, teachers need to know the appropriate responses to symptoms. For example, when is it time for kids to do self-care, and what kind of self-care they can do, such as rest and ice. Teachers need to know that they can facilitate communication with appropriate health professionals and support and follow through. And aid the follow-through of treatment and recovery. I think that's something that teachers can question students about if the student has shared that information with them. Teachers need to know what kind of accommodations to make when students are injured. Do they sit in the rehearsal and attend, as somebody brought up the other day, or do you excuse them? Do they play at all? That sort of thing. And we need to foster communication styles that, with our students, and of course everybody else that we work with, that facilitate the development of mental and emotional health, or mental and physical health. An example of this would be using the word bow hold instead of bow grip, instead of pressure, using weight. Things like that, and watching our tone of voice, not only pedagogically, but just interpersonally with our students. The second area is research. We recommended that there be a compilation of epidemiological studies in terms of musculoskeletal health issues, that because a lot exists out there, and that isn't so accessible to us as music educators, and we'd like to see those become accessible. The second thing is something that other panelists have mentioned, and that's support for music education research, for publication of music education research in this area, getting it into our own journals and getting it accessible for our own populations. Of music teachers, not just research journals, but practical, practice-oriented journals as well. encouragement of further research in pertinent areas. And some examples of research we thought of were things like ergonomic equipment design, chairs, chin rests, things like that, instruments, and so on and so forth. Special issues of adolescence. Why is it that young girls always tell me that their backs feel like they're stretching all the time? There's surprisingly little about this out there in a way that's usable for music educators. And the third that we thought of just right offhand was the biomechanics of musical performance. Chris has really started, has done a lot of this, and it's been in the Handbook of Research on Music, Music Teaching and Learning. But there's a lot of room for a lot more of that. In sports, physical educators know how a child hits a volleyball. They know exactly what happens biomechanically. We know very little about what happens when we play an instrument from a biomechanic standpoint. So those are areas that we need more research in. And then last, advocacy. I'm proud to say that our panel was the one that came up with promoting a culture of musical health. So, and what we meant by that was to have a collaborative culture with music faculty, school administrators, and health professionals, whether we're in schools of music or whether we're in K-12 buildings. A second thing, and this is kind of a corollary of the first, would be in a school of music, one suggestion could be to appoint a faculty liaison or an administrative liaison to work with health professionals and collaborate on various issues that we've already talked about. Another is including health promotion in music education publications, such as textbooks for methods classes and instrumental methods for kids. One of the members of our panel is a string education person and just published a method book with several pages in the teacher's manual on healthy musicianship. And I think we're going to need more of that as time goes on. And generating materials for in-service and workshop training. One of the things we discussed was that it's fine for all of us when we're here and we have all these tremendous resources available, but lots of us when we go home to our schools are not as well versed in these issues naturally as some of the rest of us. And so we need materials available to us to use for in-service and workshop training. I'd also like to, just to end this, say that I do think we could use help with textbooks on a general performing arts medicine level. The one that was mentioned this morning by Dr. Manchester now costs $340. And it's a little bit outdated, but my students have been buying it for my healthy musicianship class because I think it's a wonderful overview, but that's a lot of money. So if we can develop more materials that we can use that are a little less costly, that would be very helpful too. So thank you very much for your attention.